The Nigerian government has activated an emergency operations center to manage the outbreak of meningitis disease in the country. The Center for Disease Control and the National Primary Healthcare Development Agencies will spearhead the response center, which is expected to manage activities across the country.
The team will also deploy the coordinate a national communication and social mobilization campaign focused on prevention and control in states most affected. And while the Center for Disease Control, NCDC, says death toll in the cerebrospinal meningitis outbreak has risen to 336.
An NCDC spokesperson, Lawal Bakare, confirmed that a total of 2,997 suspected cases were reported in 16 states. 146 of the cases have been confirmed in the laboratory. Mostly states from the northern part of the country are affected by the disease.
The vaccine that provides protection for this type of meningitis is not commercially viable and needs to be acquired through a special process coordinated by the World Health Organization. Observe that there is need for the Federal Ministry of Health and its counterpart ministries at the state level to work together to prevent further outbreak of the disease.
We are used to that particular strain, that is the serotype A. But unfortunately, this time we have a serotype C, and we have just very few doses of that vaccine available, which is not enough to contain the level of the spread at this time. And don't forget that we don't only have serotype C only. We have Y, we have Z. And God forbid, who knows the one that will come up next year. So I think that, yes, it's not good that this is happening, but I think it's a warning signal.
Direct the Federal Ministry of Health and the various agency parastatals to work closely with the World Health Organization and UNICEF in order to acquire sufficient vaccine needed to respond to the outbreak and prevent further cases. Those in favor of prayer won't say aye. Those against say nay. But since the budget has not been completed, we should see that we provide adequate funding that will make sure that we support the fight against the spread of meningitis.
All right, a proactive move by the Senate there to provide funding to tackle this outbreak of meningitis in the northern part of the country. But is it coming a little too late? That's a question.
Well, the most important thing, like they say, better late
than never.
Than late. I mean, you're having a rise in these cases, and whatever is late to be done, it should be done. And if they're going ahead to say more funds, actually, when I read that, I felt, well, Senate is on top of the game.
Yes, indeed.
To ask that more funds be provided.
Of course, let's remind you that this particular outbreak is strain C. That's the way I can, describe it as a layman. I don't really understand the technicalities involved, but it's a strange strain for Nigeria, and that in itself, causes another problem. And then you have a major shortfall in Zamfara state alone, the major place that's been affected. They need about 3 million doses of the vaccine. And
they've only got about the
500,000
or so from
a
World Health Organization, according to Chikwe Bazu, the NCDC boss.
Indeed.
Another interesting thing anyway, and he says they're going to be asking for it because, like he said, it came on them suddenly. So when it comes, they have already, they have a requisition there.
Yeah.
It's only when meningitis sets in, they begin to ask for them. I'm wondering, well, I don't know, maybe that's how it works. But I'm wondering, why don't they have them on the ground?
Before it breaks out, considering the fact that every year Nigeria and the Sahara Belt, where this meningitis affects, it's a yearly thing. So we should be more proactive than this fire brigade approach that critics have always said that is the attitude of Nigerians towards things like this. And 6 of these meningitis causing bacteria also they can cause an epidemic, so you might have a problem on your hands if
that's what it is leading to, actually, when you have 16 states out of 36. And one again begins to wonder why it's prevalent in the north, because from the reports we're getting, is prevalent in the north.
Of course, states like Zamfara, Sokoto, Katsina, Kebbi, Niger State, worst hit, and children between the ages of 5 and 14 have really been badly affected. As usual, children would always be at the receiving end. We had an expert here the other day, and he tried to explain to us that there are two different strains of this meningitis, like said, or causes. You have the viral and the bacterial. And my question to him was, does it really affect the outcome of the disease, how the treatment and the result of the treatment at the end of the day? And he was like, yes, absolutely it does. If it's a bacterial infection, it's even more dangerous.
And then the way it seemed to have, because from what I heard here, it's even gaining grounds and rising to epidemic proportions. The way and what provokes it to rise to those kind of proportions is what one can't.
It really is. Now we have Dr. Olalekan Makinde on the line to us to talk to us about the latest development. Good morning and thanks for joining us on the show.
Yeah, good morning. Nice to talk to you.
All right. So what do we know about this? Any latest developments? We hear about the major shortfall in vaccines. What is the situation with that now?
The Ministry of Health is doing a lot on that with the international partners, and the vaccines that have been brought to the country to be distributed to all the states. And so I think things are going on the normal Nigeria thing, when we have lost more than 300 people, everybody is running around now. But you know that this outbreak started in November 2016, so it has, in a way, already reached its peak. And so the vaccines are going on. They're setting up emergency centers across the nation. But I think these things are supposed to start earlier. That's my take on that. So we're coming up, and I think we're almost over with it.
Okay, good. What's the fastest way possible to begin to contain the spread of this disease?
Because when an epidemic starts off, like all these things started off November in Zamfara State. Normally, when people start coming down with things like this, we also have started doing something about it maybe in January, when we noticed that this thing is spreading. Until now, that we have it in 16 states. That's why we now have everybody running here and all that. So the fastest which I've done is immediately the outbreak started, the ministry should come into this, international partners should have been alerted. Then at that time we have set up our emergency centers that will be able to take the cases, and then because this disease we are talking about, or this meningitis, is something that has both vaccine and drug. So there's cure, there's vaccine. So things like this normally should not be happening in a nation like Nigeria if we are taking things more serious. And one of the problems also we have is that most of those states, there are no edge facilities. The edge facilities also have the medications that are needed to treat people that have meningitis. You can be aware already there have been 1 or 2 cases even in Lagos. But no, because Lagos usually have more edge facilities, you have doctors and all that. Those cases have been treated well, and maybe those guys have gone home. So when things like this happen, we are supposed to be more proactive. This is what we're preaching all the time. If we are more proactive, we will not lose 331 people before we are now looking for vaccines and running over the world and all that.
All right. Now, with this emergency centers, what do we expect to find at those centers as quickly as possible, if you can, before we go on break?
Yes, the centers, what we're supposed to have there is there are people there that can be communicated with. Therefore, they will send out some numbers to people in the state, so that if they have suspected cases, they call into the center, and the center can get them to the facility to be treated and all that. So that's the purpose of the center. So the centers also go to give more information, and then let people be more aware of the disease, how it presents, what to do when somebody have it, and all that. These are what the center is supposed to be doing. They're collecting cases, and then also that the laboratory confirmation have only been done about 131 cases. So there are many of the cases that were not confirmed by laboratory, so we cannot be too sure on those ones. So the center now will be able to help with that, know where people can go, put the samples to where they can be identified, and then they can be confirmed to be meningitis.
All right. Zamfara, from reports, Zamfara State, Sokoto State seem to be most affected. why are they susceptible to this particular disease?
Okay, you know what, we'll take that break now. We're ready to do just that. Dr. Lalekon Makinde is the expert talking to us about this. But we can continue, actually. So go ahead.
All right, so then, Doctor, you're still there?
Yes. You know, Sokoto State, as what I've just read now, the emergency center they set up, they have about 5 cases less there. Okay, they had 50 last month. So, the disease already has gone to its peak and it's already coming down. So that's all. The thing is that the so-called meningitis belt, Nigeria is in that belt. And it's not only Nigeria that's experiencing the epidemic in meningitis. There are other states, Togo and Co are also experiencing the same thing. So Nigeria is in the epidemic belt. We've had cases in time past. The only difference now is that they say that meningitis strain we're having is type C, not type A that we are used to. That's not the difference. And this is not the worst one we've had. We have the worst one in 1996. That we have more than 110,000 cases, and we had about 11,000 deaths that year. So this is not the worst we've had. Just that after all the efforts we've made on meningitis, we should not be having this kind of outbreak again happening in this part of the world. That's just the only thing.
Yes, and unfortunately, here we are again. A question I'd like to pose to the NCDC, the Center for Disease Control, is what kind of collaboration, if there is any, that is going on between Nigeria and, of course, the countries that you call the meningitis belt. Now, inadequate healthcare is a major problem in Nigeria, Dr. Makinde, especially in the rural areas. I wonder what happens with those people. Are they left behind, especially with this? I wonder how vulnerable they are to this disease.
Yeah, this is the time. I feel as a nation, we need to sit down and tell ourselves, are we ready to save our people from all these diseases that some nation have not heard about in years, in hundreds of years? Because some of these states we are talking about, before somebody can get to a health facility, he has to travel maybe 7 hours. So if these are the things, that is why in those states we are talking about, Zamfara, Sokoto, and Co, we are recording many deaths. And I can tell you, we are talking about 231 deaths. That is not the number. That is the one we can estimate. Because there are many people that have died in those areas that nobody can get to. So we talk about primary health care. We are still going back there. If the government is serious, they will not just do this after all the noise again, everybody go and sleep. No. This time around, we should make sure we can have primary center in all the states and all the local governments, so that by the time people have things like this, which are treatable, meningitis is highly treatable. If you put the person on drugs, the person cannot die. Okay, so but when the facilities are not there, these people will start to self-medication and all that, and that's why we're causing so many deaths. So if a person presents and the person has access to health facility, you have health experts to work on the person, we should not be talking about 231 deaths. It is not acceptable in the 21st century in a country like Nigeria.
All right, Doctor, I'm taking a break. I was going to ask you what people should be doing now, to prevent it.